So our channel is all about evidence. I was at Johns Hopkins as an epidemiologist, and so I trained and practiced for a long time as someone who can understand the real evidence behind studies. That's not very common. Most docs are not so good at that. So people come to us for the real evidence. Sometimes that can get a little bit dry, and sometimes patients go, dang, I listened to a whole lot, and they'll listen to us patiently, and then they'll say, okay, got it. Now, what would you do? And it's interesting. I tried to pin Jesus down on that about minute 3, and as you can see, he tried to wiggle out. But we got to what would we do? The short story. Just hang in there. Thank you for your interest. It's John Ioannidis. He's a professor of medicine and epidemiology at Stanford, and he wrote what was for a long time the most downloaded article off of PLOS, the Public Library of Science. And that article was titled something like, "Most Published Research is Wrong." And it sounds outlandish when you hear the title alone, but once you get into the details, you begin to see exactly what Jesus is talking about. It's like, number one, it's something that's proving what we already know, that's not publishable. And then you start getting into, okay, if it's a surprise, was it really real? And there's so many ways that it might not be.
Now, other stuff to mention about this specific article. We don't know how the intervention was monitored. Basically, we believe it wasn't monitored, just adherence to the supplementation, because as we mentioned, this is not a randomized controlled trial where you are following and tracking adherence to supplements. In this case, they're relying on self-reporting questionnaires, which might be flawed. And even though they're reporting of 85.4% adherence of 5 years follow-up, it's really good. How reliable is the data they are collecting based on just questionnaires? And we have covered multiple questionnaires studies in the past, and even on those ones we have mentioned. For example, nutritional study. When you are measuring or trying to measure the impact of a specific diets, those are going to have that same problem because you are relying on what the people tell you they're eating, and that might be real or might not be real. Also, the outcome of interest was also measured by self-reporting. Self-reports of fractures are far less likely to be associated with significant memory errors than self-reports of vitamin intake. Further, authors did verify most fracture reports against medical record, and there are certain ways on how you get the information that can make a study more reliable or not.
So, Jesus, at the end of the day, as you know, we'll often go through the science, the pros and cons when a patient's asking what they should do. And then at the end of all that, they patiently listen to us go on and on and on and on. And then they say, yeah, well, what would you do?
Yeah. I think it's just part of this big world of information that you get. So the main problem that I have seen, and we have seen that in multiple articles, once an article get to a more mainstream media, and then you see them on Healthline or Med News Today or something like that, and they come with this flashy title of researchers from XYZ Academy say that vitamin D doesn't work. And if you just read the title, you might go with the wrong assumption. And we like not to go on kind of the opposite side. So we are more like conservative in this perspective on saying we don't think vitamin D doesn't work for fractures. I think it's just a matter of getting the best amount of vitamin D, but you cannot rely on vitamin D alone to prevent fractures. There are other multiple factors that you need to be considering, such as your body weight, body fat, if you have osteoporosis and if you need calcium supplementation or not, the kind of activities that you do, the genetics, and just aging. So it's never just one supplement that is going to take you out from any problem. There just other stuff that is going to help you to get to your objective.
Well, I'll paraphrase too. I'm thinking the same thing you are, and that is, number one, I'm taking vitamin D. I started with 5,000 international units a day, and I take it to keep a level between 60 and 80, 60 and 90. The other thing I do is keep my weight down, but I also do a lot of resistance training.
Yep. And another thing that we haven't mentioned, in this case, we're talking specifically about fractures, and we might want to cover this, Dr. Brewer, as well in the future, but there are multiple mechanisms on which vitamin D is decreasing inflammation. And we do recommend vitamin D for those purposes specifically. Of course, it might help with fractures, but the more important thing we use it for is to prevent cardiovascular disease. It impacts inflammation through different mechanisms, and it would be a good idea to cover that in the future, just so people know, hey, I know I'm taking vitamin D. Dr. Brewer says it's a good idea to take vitamin D, but I don't know why I'm taking it specifically, right? Sometimes we get that a lot. People that are taking 10, 15 supplements and they just know, well, I know it's good for my body.
Looking to improve your health and add decades to your life? Join me and the PrevMed team December 1st and 2nd in Tampa, St. Pete for the Heart and Stroke Prevention event. This is an event, not just a conference. You'll not only learn how to prevent heart attack and stroke using my battle-tested methods, you'll also access accurate, predictive testing that the majority of physicians never use because they don't know how. All you need to do is click the link below this video or simply go to PrevMedHealthTampa.com to sign up. Hope to hear from you. Thanks.